We'll be looking at another important category of iron overload today, and today we'll be looking at African iron overload. All right. Formerly, it was called Bantu siderosis. Okay, but I still brought up the name Bantu siderosis because some textbooks still use the name Bantu siderosis. Okay, so African iron overload, also known as Bantu siderosis, and we get to see that this is a secondary cause of what hemochromatosis. Okay, so it could be that this is a secondary cause of hemochromatosis. Okay, you could see health issues from hemochromatosis. There will be skin darkening, there will be heart failure, there will be liver diseases, cancer, cirrhosis, there will be joint pains, and there will be diabetes. Okay, so looking at African iron overload, we said that African iron overload was formerly referred to as Bantu siderosis. It results from a combination of increased iron absorption due to what? Possible ferroportin gene defect and an increased dietary iron intake. So basically, let me shed small light on this. Some Africans, they actually have this gene defect, okay, that will actually increase the level of ferroportin levels. Okay, I know that ferroportin is basically that protein that is helping to um, for iron absorption. Okay, so you have a problem of increased iron absorption already, and most diets of Africans is meat. Do you understand? And meat is so much in iron. Do you understand? So you have a problem of iron absorption already, and you are still taking diet that is rich in iron. Okay, so this will result in African iron overload. So it is a problem amongst Africans who drink traditional beer brewed in non-galvanized iron cooking pots. So it could be that this pot was made up of iron and it's not well galvanized. So as you are cooking the beer, some parts of the iron is even joining in the beer. Okay. So however, the disorder does not develop in all beer drinkers, and not all patients with iron overload consume excessive amounts of beer. Okay, so there may be possible genetic defect that may confer the susceptibility. Okay, because before somebody is coming down with African iron overload, it could be that this person actually has a defective gene. Okay, so plus having this defective gene, the person is actually taking diets that are rich in iron. Do you understand? So African iron overload is not due to mutations in HFE genes. That's the what human hemostatic iron regulator gene. Okay, so this is not due to regulation of iron. Okay, and it's not linked to the HLA flow cost too. Okay, this is due to a defect in the ferroportin gene. Okay, possibly. All right, it has not been fully proven. Okay, so guys, the pattern of iron deposition amongst persons with African iron overload differs from that among those with what hereditary hemochromatosis. Okay, so in African iron overload, there is marked iron loading in Kupffer cells as well as what hepatocytes, resembling the pattern seen in patients with what transfusional siderosis, and also suggesting a defect in erythroid iron recycling. Okay, so guys, cirrhosis occasionally complicated by what hepatocellular cancer is the predominant organ manifestation, while cardiomyopathy and diabetes are what less common. Okay, so in people who have African iron overload, they are most likely to actually come down with this hepatocellular cancer. All right, this is what we call HCC. All right, so guys, although serum ferritin levels are elevated, the transferrin saturation does not always reflect the true extent of iron overload in these patients. Okay, so patients with African iron overload are probably more susceptible to infections than other people. Okay, so guys, this is it about African iron overload. We spoke about the possible causes, we spoke about the symptoms. All right, we didn't talk about therapies though. All right, but therapy is basically okay. You have a gene defect, okay, and it's making you to actually absorb too much iron. Okay, so you should try as much as possible to avoid uh, meals that are rich in iron. Do you understand? So if you must take meals that are rich in meals that contain iron, it should be in the minimal amount. Okay, so guys, that's it about African iron overload, also known as Bantu siderosis, and bye for now.